Foods to avoid for healthy eyes. Yes, there are foods that can harm your eyes. Too much caffeine can overstimulate the body, overstimulate the optic nerve, cause oxidative stress. That can damage the sensitive tissue around the retina. Condiments have high salts in them, high sugars. Again, not good. Excessive dairy. Dairy in Chinese medicine causes congestion in the body in a lot of cases. When you get congestion or poor circulation, again, that's going to affect the circulation to the eyes. We all know about the refined sugars, excessive fruit juices from concentrate, corn sweeteners, bleached white flour products, excessive alcohol. I've found particularly hard alcohol. More of my patients who've had a history of drinking hard alcohol has issues with eye problems. So I usually tell people that, you know, beer, wine, if they want to have a drink, that's fine. But really try to stay away from the hard alcohol. Hydrogenated fats, a big problem these days. Really watch that. Causes really nasty problems with the body, including a lot of oxidation and congestion in the body. Liver issues, things like mayo, margarine, salad dressing, vegetable oils. Try to use these really sparingly. I know some of us love, you know, our turkey sandwiches with mayo, or, you know, your Thousand Island salad dressing. It's really tasty, but, you know, moderation. Junk foods, fried foods, processed foods, all pretty much self-explanatory, right? Excuse me. There are common metabolic imbalances that we started to talk to that I've seen in my practice that are very commonly associated with vision problems, especially degenerative vision loss. Blood sugar imbalances being one of the leading causes, oxidative stress, either too much oxidation, which we know we use antioxidants for. There's also a condition of too little oxidation, which is very seldom known. Not a lot of people are talking about that, but it's a real issue. Conditions like diabetics often have too little oxidation in their body. It's the insulin that they take and the medications that cause too much oxidation that damages the eyes. Patients with macular degeneration and glaucoma often have too little oxidation. Patients with macular degeneration, dry type, and things like retinitis pigmentosa, those will tend to have high oxidation. So this business of giving everybody antioxidants to help preserve vision is not really always the best thing to do. You want to be clear about what's going on. Low ATP energy production. Low energy production, you're not going to get that metabolic process and energy distribution through the eyes. Thyroid and adrenal imbalances are often associated with eye problems. Low thyroid and low adrenal conditions. Chronic inflammation is they've done a lot of recent studies that are showing that chronic inflammation leads to conditions like macular degeneration, dehydration as well. Yes? With the adenosine triphosphate, when you're resynthesizing the adenosine diphosphate, the liver back to add the extra phosphate back in, does that also slow that as well? Correct. So recovery from exercise? Absolutely. Absolutely. Other eye stressors, fluorescent lighting. You know, try to get natural lighting. Even they have the light bulbs now that you can go and get the natural lighting. It really makes a big difference. You know, it's like $5 difference, $10 maybe. It's really worth it. Save your eyes. I think everybody here would agree that your eyes are pretty important. At least we all value our vision. Overuse of the eyes in dim light. You know, this is sometimes at night too. People go on the computer without putting the light on. Just put the lights on or read in dim light. It's really important to have adequate lighting. Staring for long periods of time at TV, monitors, etc., even reading. Change the distance of the book you're holding or the magazine you're reading. That fixed staring in a certain position is really what gets your eyes and stresses them out. Swimming pools like chlorine. In Florida, they're doing a lot more swimming pools now with natural salt instead of chlorine. It's a lot better for the eyes. Air conditioning and forced hot air in the house. You know, that dries your eyes out, chronic dry eye syndrome, prolonged mental and emotional stress. I mean, I think we can all see how we all know how that affects the whole body. Why should the eyes be any different? And in Chinese medicine, again, the liver is what manages the stress in the body. So the more stress, emotionally or mentally or physically or chemically, that's going to negatively affect the liver, which, again, as we said, is going to cause some eye problems. Real quick, there's another device called Microcurrent, which is very common among practitioners who are specializing in helping people with eye conditions. It's similar to TENS. It's most commonly used in research for macular degeneration. A lot of studies are now being done on diabetic retinopathy as well. It stimulates the acupuncture points. If you look at the lower part, the lower picture, these are acupuncture points around the eyes. You put the pads directly over the eyes, and these pads, these microcurrents stimulate the acupuncture points around the eyes, which increases blood flow to the eyes. Optic nerves get regenerated. Very, very beneficial. And again, none of this stuff is going to help everybody all the time, but there's about 70–80% people are showing very good. And here's some research. There's a lot of research. These are just two of the studies that I got. Again, showing positive results with macular degeneration, retinitis pigmentosa, various retinopathies, so on and so forth. They're showing an average of 1 to 9 lines. That's on an eye chart of improvement, and that's just using the microcurrent. So something to consider. Chinese aromatherapy, again, the essential oils, fast absorbing, easy to use. There's really good companies out that make essential oils, and there's some real junk out there. So one of the companies I recommend is Young Living, and I know there are a couple of other good companies there. Low risk. You don't want to put the oils in your eyes, but you want to put them around the perimeter of the eyes a couple times a day, maybe in the morning, maybe in the evening before you go to sleep. There are specific oils that benefit specific eye conditions. So things like frankincense, lavender, and Roman chamomile are good for things like dry macular degeneration, conditions like Stargardt's. Diabetes do good with cypress and helichrysum, more so with bleeding. Helichrysum is a good essential oil to use for bleeding. Glaucoma, dry eyes, peppermint, wintergreen, those mints seem to help a lot. Retinitis pigmentosa, you want to use warm, spicy type of herbs to help with the eyes. These are things going to be like cloves, cinnamon, ginger. These are help. You probably want to dilute these with another oil because they can be pretty spicy and thermically warm and actually even burn the skin a little bit. So cut them with some oil. Ginger, cinnamon, coriander, lemongrass, eucalyptus, or cypress are very good for cataracts. Also, microcurrent is very good for cataracts. So those are just a few. We have a lot of this information if you want to come and ask us questions on our website too. Chinese wisdom for healthy eyes. Moderate, overwork, and overstrain. I originally put eliminate overwork and overstrain, but I don't know anybody who can eliminate overwork or overstrain. So a lot of people are susceptible to that. Try to balance your emotions and stress. Take a break. If you've been working real hard, which we all do a lot of the times, give yourself time to relax. Do your hobbies. Enjoy your time. Don't overwork. Control your diet and eating habits. Again, easier said than done, but there are specific nutrients that are beneficial for the eyes and for your body on the whole. Healthy body means healthy eyes. Get adequate rest and relaxation, stretch and exercise, practice Eye Qigong. I gave you some real simple stuff with the near-far vision exercises. There's very specific Eye Qigong exercises which are very, very beneficial for the eyes, and they're very, very simple to do. Reducing the risk factors of degenerative vision loss, use acupuncture and Chinese medicine to maintain good health. Some things that may help to reduce the risk factors for healthy eyes: keeping the blood pressure normal, blood sugar normal, keep the cholesterol down, exercise, don't smoke, minimize your consumption of hard alcohol like we discussed, keep the water intake up. Sunglasses, UV protected sunglasses are very important too.